Welcome back to In Time TV's On the Edge Conversations in Emerging Medical Technologies. I'm Dr. Jonas Moses. Today we are talking about OCT, optical coherence tomography, and its use in ophthalmology, especially in retina. With me today to discuss that is Dr. Jennifer I. Lim from the University of Illinois Retina Center. And during the commercial break we were talking about going to diabetic retinopathy next. So why don't we do that? We have a slide up for that. What number is that?
That would be slide 20.
Great. There we are.
Great. And diabetes, as I said, is really one of the diseases where OCT has a very crucial role in helping the physician, determine their outcomes and treatment. And recently, there have been a lot of papers on OCT and diabetes, and this particular one, which was just recently published, and this came out of the Hopkins group, deals with looking at patients who have macular edema. They've been treated with laser, but they still have edema, and you can't quite exactly know why that is, that they haven't responded to lasers. So you want to see, is there some other reason? Is there a mechanical component?
Is this diffuse edema, or is it like a bubble of fluid?
It's more diffuse edema for the diabetes. And so what they found out, interestingly, is that when they looked at the macula in these patients with diabetes, they found either focal areas where the vitreous, which is the jelly in the eye, is pulling on the retina, or areas where it had a plaque-like adhesion. And this was found in about 58% of their patients. And so they found out that perhaps in these patients there was a mechanical component, and that's why the laser didn't work. And so it actually opened up another avenue and lent credence to why people do vitrectomy when we have vitreomacular adhesion. And interestingly, they couldn't see the vitreomacular adhesion looking clinically. Okay. So the OCT was like another eye.
Because the membrane is so subtle?
Yeah, it's subtle, and the variety of reasons. Perhaps there was a mild cataract that was obscuring the view.
Okay.
And you could see it on the OCT, so that was really useful.
What are we looking at in these in this particular slide?
This is showing the...
So that is the macula at the center.
Right, and you can see where the two arches connect. There's a little area of elevation.
Yes.
That should actually be going the opposite direction. Remember, it should look like a V. And it said it's swollen, and you have little black areas, which are areas of swelling in the retina called cysts. So that's a focal point of adhesion. The slide immediately to the right there shows an orange plaque, and you see the two humps, but
yes,
there's a space. That's more of a plaque-like adhesion where it's kind of stuck on there. And mechanically, if we did a vitrectomy, you could relieve this traction. And theoretically, if we relieve the traction, perhaps then the retina would settle back down and you'd get some improvement.
And vitrectomy is actually going into the vitreous at the back of the eye and using a tiny
20 gauge or 25
gauge needle, right? And it's actually cutting vitreous and releasing tension at various sites.
Right, it cuts it, and then it also aspirates it, so you remove it from the eye.
Removes it from the eye. Okay.
So it's pretty amazing technology that we have available today. I'd like now to go to the next slide, which is slide 22, I believe. And this is an eye that also has diabetes that didn't respond, as you can see, to 7 sessions of focal laser treatment. And so then the OCT was done, and again, you see that area of adhesion from the vitreous pulling up the retina. So again, it just drives home the point that if you have a patient that you've treated with diabetes and you've treated them with focal laser, which is the standard of care, and they're still not improving, you need to go the next step and look in and see, is there a mechanical reason that they can't see?
And OCT can provide that
and
image.
OCT can provide that fill in the missing blank there.
Yes.
Which is really quite nice. But you might say, well then, if OCT can do that, is OCT a substitute in clinical trials for looking at outcomes? And it's a surrogate kind of marker, but it can't take the place of visual acuity for diabetics, because as you know, with diabetes, you can have poor blood flow, you can have this macular traction, you can have other reasons for the patient not seeing, so you can't just use OCT as an outcome. But I must say, in the clinical trials that have recently been done, OCT is a crucial component as a secondary outcome that has been added to these studies.
Well, you mentioned that it can't replace other tools that we have in the assessment of disease. I think of visual field testing, for example, and color vision testing as useful tools. When you begin to see, because we're talking about the macula, you see blue drop out early on, so you do visual field testing with blue targets, and you can appreciate very early changes there, even before you can image them. As well in glaucoma, and we haven't talked about that here, but that is a whole field that's contiguous with this. it certainly impacts the retina and the optic nerve. I can begin to appreciate how OCT would be very useful, because by the time you see a visual field change in glaucoma, there's significant loss of retina, of the retinal epithelial layer. So, you know, I can, in fact, recently I learned that Zeiss, who was one of the early pioneers back in 1994, I think they released their first innovation in OCT, is now releasing in February, I believe, a whole software component for their Stratus?
Glaucoma?
Yeah.
The Stratus is the current one, so
right.
it's the next.
But this is going to be an additional software package for glaucoma. So that's very exciting, and that was actually the impetus for this show, is learning you know, that the technology is really burgeoning right now. Do we have a next slide?
Yeah, and before we get to there, though, I just wanted to mention, you know, the OCT can look directly at the nerve fiber layer, and it can measure it, and I think that's what's really important for the glaucoma doctors to be able to elicit from this new software and this technology. And they can also image the optic nerve directly, and they're doing all sorts of interesting volumetric analyses of the optic nerve. And I did mention earlier, but I will now, that you can use the OCT, and you can use all these images and put it together, and you can get 3D reconstructions, and you can get volumetric measurements.
Much like you can do with confocal microscopy, when they're looking through layers of biopsy.
Exactly.
And the difference is that, as we said earlier, we're talking about a living being as opposed to something that's on a slide. Right.
And, you know, bridging that gap between clinical application and research, we've actually looked at the OCT in patients with retinal degeneration. And I believe it's slide number 8. If we look at that, we'll see an example of how we use the OCT to determine retinal thickness.
Do you want to bring that up next?
If we could.
All right, slide number 8.
And here we go. And if you look here, you'll see it says OCT normal versus dystrophy. Well, dystrophy is another term we can use for retinal degeneration, generic term. And this particular patient has what we call retinitis pigmentosa. And this was a research project that we're currently working on. And if you look at the top slide, you'll see a normal retina. But if you look at the bottom slide, you'll see that the retina is thinned, and you're missing some of the white lines. And what the OCT shows us is that the photoreceptor layer is markedly thinned in these degeneration patients.
I want to come back to this slide right after this commercial break. We are going to break away for a brief minute. And stay with us. You're watching Conversations in Emerging Medical Technologies on The Edge.